And so when I came here, that was my focus finally, to take care of my smile, myself and my smile. And Dr. Kelly just did a great job.
It was pretty easy. It was just a few appointments. The first appointment, they prepped my teeth and took impressions, and then the next appointment, I got my luminaires. So the process was very short and easy, and I'm happy with my results.
It wasn't as bad as I thought, and mostly because I knew I had to get it done. So if I put my mind to it, it's like, let's just get it done. And you know, she numbed my gums, and you know, like she always stopped when I told her it was hurting. So she was gentle through the whole process. So
I had about 9 months until I was going to get married, so we started on the process right away. They had taken impressions of my teeth. What happened was 2 weeks later I came in and they showed me on the computer every 2 weeks how my teeth were going to change, and then at the very end what my teeth were going to look like. So I just started coming in every 2 weeks, getting my new trays in. It was probably a little painful, like the first time you get your new trays in, but a day after it was fine. There wasn't any problems, and so I just kept coming every 2 weeks up until I was ready to get my permanent trays in. So it's a very easy process, very simple, and not very painful at all.
Dr. Kelly makes it really easy. She has the type of personality that puts you at ease, and the visits were, the first one was long, but pain, no. I went back to work right afterwards.
Yes, she was very nice, and she told me everything I needed to hear as far as realigning my jaw, and she just seemed to be a real nice person. Talking to her, and she knew what she was talking about.
What should somebody look for in a dentist who's doing luminaires?
Well, you want to make sure that doctor has gone through a lot of trainings, because it sounds very simple and easy, but you need a lot of training as well to get that result.
Well, because I've heard dentists who call themselves a cosmetic dentist, but maybe they haven't had the training like you have. So having the training is essential to having great results.
Exactly, training and also a lot of experience.
Is everybody a candidate for luminaires?
Absolutely not. A lot of cases there are, but there are some cases, that's why it really needs a thorough diagnosis and as well. And my job is to listen to our patient and what they really want, So my first question is, why are you here? What kind of smile you want? So I try to approach what's their best interest. And then I put my knowledge and my training into them, and we make it as a whole.
All right, so do you go about the process with the patient on choosing their smile?
Yes.
Okay, because what if someone brings in a picture of a celebrity, or they want their teeth to look like maybe a friend of theirs? Is that possible?
Well, they do bring actually, the pictures of like Brad Pitt or, like Angelina Jolie. I mean, all these like celebrity pictures too. And they'll say, doctor, I want this, I take their picture before, and what program does is it shows what it would look like. So we can customize the look, and then I show to the patient with different design of the smile, and they'll choose it eventually. So the Brad Pitt smile, it might look really great on him, but it might not look good on, the patient, himself. So
right, because everyone's facial structure, jawline, everything is so different that you want to make sure that you're customizing it to their facial structure.
Exactly.
What you're saying.
So I don't just look at their teeth only. I usually look at their even whole body and whole face, because that makes a big difference. Exactly. Actually, my motto is, I don't treat teeth, I treat smiles. So,
Dr. Kelly, what are some of the most frequently asked questions of your patients?
First thing they always ask, is it painful?
Of course.
Yeah, because they know it's not going to involve just one tooth, most likely. So they're like, doctor, is it going to hurt me? That's the first question they always ask me. They want to have smile, but they always ask me about.
And your response is?
And my answer is probably not, because with my knowledge and all the training that I got and all the experiences, I try to make my patients most comfortable as possible. And I go through all the procedures with them, and then after they fully understand, that's what we start. So pain is not something that my patients complain about. Another frequent questions I get is, what's my smiles gonna look like after all this? And we have like computer programs where it kind of shows what their smile is gonna be, and also I want to make sure they get the natural smile that fits them. So I like to customizing everybody's smile. So that's my goal.
What about cost, Dr. Kelly? Do people ask about money, how much it's going to be?
Absolutely. They always ask that question. But there's a lot of ways that we can do it. As little, even whitening can change a big difference, you know. So there are a lot of options, and then we will work with you, and we do a lot of affordable dentistry.
So it's not impossible to get a great smile.
Absolutely. As a matter of fact, after the procedures, money's not really an issue for them, because they see what we can do for them, and then it's just changing life experience. You cannot really compare with the money at that point. So we don't really get the complaints about the money issue after all.
Well, I'm sure you don't have anyone saying, I want my old smile back versus now their new smile.
No. Now they have $1 million smile, but they obviously they don't spend like $1 million.
Right,
but, you know.
right.
So I tell them, you got the $1 million worth smile, but you didn't spend that much, right?
A lot of times in cosmetic dentistry, and we've been around, but how do someone avoid that big tooth look?
That you really need to have a thorough diagnosis. That's what's very important, having thorough consultation. And and also I collect a lot of data from the patient's mouth, and we can definitely avoid the big teeth look. So it's not about just a Dr. Kelly smile. It's about creating the natural smile that fits them. So some people probably need a little bigger teeth, or some people might need the smaller teeth. So that's where I evaluate, and that's what I specialize.
And this leads me to, so the patient gets to work with you one-on-one on designing their smile.
Yes. So I spend enough time to make sure they understand, and we have a good understanding little consultation time. So I sit down and I make sure to answer every single questions what they have.
When somebody's getting a smile makeover, tell me about the process.
First of all, they will have a one-on-one consultation with me.
Okay.
So we go over all the design. And once they fully understand, we start the procedure. And there is a temporary phase where a patient has to go through. And most likely when I give them the temporary crowns or veneers, they're expecting the result. It's like about 90 to 95% that.
So they get to wear the temporaries for a
Exactly.
certain amount of time to make sure that that's exactly what they're wanting.
Right.
And what you
so
want as
they
well.
And then they get used to it, and then at that point we can also adjust it little by little, so that's where it's a very important, phase as well.
Okay, so when you say adjust, you mean like if there's something that needs maybe a little more rounding or just little
Exactly.
specifics, then you can go back in and make those changes.
So maybe more little detailing, that's what it is.
And what about color?
The color, actually, I talk with the patients, and we have a lot of samples of the colors, and I show the other patients, their teeth color as well, and we actually, most likely the patient picks their own color, but I give, what I think, suggestions, but whatever makes them happy, then they will go for it with it,